Welcome, everybody. If you or someone you know and love has been diagnosed with an autism spectrum disorder, then you have been entered into a deep, deep well of information, some of which really good, some of which absolutely terrible, okay? And some of which we're going to call myths, legends, hocus pocus kind of stuff. Today, we're going to go through the myths and get rid of the ones that are remarkably unhelpful for your life. Welcome to the show. Oh, yeah. Let's get started with myths. I am Dr. Nate Noble, developmental behavioral pediatrician, clinical geneticist, and self-proclaimed internet sensation. Okay. I'm joking. And today we're going through a very specific list of myths. I'm going to put them up on the screen because I want you to see this. Okay, here are some of the myths that we are going to go through. And as we go through this, we're going to fill in the blanks. So stick with us all the way through. At the end, I'm going to give you some information on how to make decisions in regards to what interventions might be logical next steps. And we're going to give you information on what's coming up in 2025 in terms of courses that you will gain benefit from and you will not find in the same manner anywhere else on the internets. That being said, I want to value your time. Let's get started. Our objectives with this channel, with the work that we do on our website, are very simple. We want to educate you with these videos. We want to equip you with classes, and we want to encourage you with a newsletter. So if you want any of those things, visit us at drnatenoble.com and we will get it. Let's get started. Individuals, autistic people, okay, I'm going to read it. Autistic people, this is a myth. Autistic people don't want fill in the blank friends. What? Listen, I wish I'd never heard this before. Okay. I sincerely wish that this wasn't something that we had to give time, energy, and space to on the internet's most popular developmental pediatrics live show. Okay. But it's real. Listen, an individual, whether it's you watching or someone that you love, a child, a family member, if they have been diagnosed with an autism spectrum disorder, if they identify as autistic, it does not mean in any way, shape, or form that they don't want or value friendships. They have shared interests, reciprocity, respect, trust, and acceptance. These are the things that research demonstrates to us are highly valuable and signify a relationship that is going to be successful when in the context of an individual diagnosed with autism. I know that there are individuals, all individuals diagnosed on the spectrum value friendships, but the thing we have to understand is that they value them in a different way. Let's look at what I talk about. Yes, there's challenges, okay, in forming and maintaining these relationships. Yes, there's things that an individual may value. There's ways that they may start a conversation. There's things that they may be predisposed to in terms of topics or proximity that might set that social interaction apart from other interactions, but it doesn't mean that they don't value the time that you are spending, the time that you're spending together. So if you have a child with autism, or if you yourself have been diagnosed, please understand that don't listen to this ridiculous myth that you don't, or your children don't, or people you know don't value social interactions or friendships. Individuals with autism can feel a full spectrum of emotions, which we're going to talk about next: loneliness and a longing for deeper connection. Some of my best friends, most of the people I spend most of my days with over the last 20 years are on the spectrum. And I got to tell you, I love them. These people are absolutely fantastic, right? Now, sometimes do they have a way that they interact with me that's a little bit different than what you'd expect? Yes. Do you, as a parent, need to educate those around you or educate those around your child in regards to ways that your child may show affection? I'll come into a room. Sometimes I'll get a lick. Okay. Now, I'm not advocating licking people, but it's not uncommon for me to get a lick every once in a while when I'm examining somebody else, get a little lick. Now, that is oftentimes a way that an individual that I'm working to serve or partner with is showing me an affection. Right now, we got to work on that. That's not going to work in the general public, but it's still a way that we're trying to get. I get smelled. I get a lot of smells. Okay. I get some real deep hugs, right? I get some real aggressive high fives, but they're all meaning the same thing. Individuals with autism have friends. They want friends. They're good friends, but we have to spend the time, energy, and resources to educate those in your orbit about how it is that your child or you are demonstrating affection, or interest in a social interaction. So myth number one, 100%, it is false. Of course, individuals with autism want friends. Number two, people with autism don't feel emotions. Oh, come on. Are you kidding me? People with autism don't feel emotions. Again, a very common misconception, a myth. Now, I like a good myth as much as anybody else. Yeah, there's Easter Bunny, he gives candy to the baby. There's, Santa Claus, all this stuff. I love all of them. I love me a good myth, except when a myth is absolutely inaccurate and terrifying. Okay. And this, of course, is one of those. People with autism don't feel emotions is not true, because then what you're saying is when they express emotions, right, it must be because something's broken or wrong, right? They have constipation, they have a sensory overload, and those are maybe true things. Okay. But sometimes they're having an emotional outburst because they're feeling an emotion. They're reacting to a situation. And it's important that we acknowledge that. Okay. So let's look just real quickly at this. Individuals with autism have a full range of emotions. They do. They have a full range of emotions. They may process and express these emotions differently, and certainly they can have misunderstandings, right, about not only their own emotions and how they're feeling and expressing them, but also the emotions of other people. Okay, there is a term for this when it comes to expressing their own emotions. It's called alexithymia. Okay, A in medical terms, or in Latin, a typically means without. Lexi is lexicon or verbiage, and thymia is mood. So the alexithymia is the inability to put words to mood. So just because they're having an emotion, right, they're having a reaction, it doesn't mean that they're immune to having reactions or emotions in general, but oftentimes they may be experiencing it in a way that isn't necessarily reflective of the tenor of the room, but it's still real. Okay, maybe heightened emotional sensitivity to not only what they're feeling, but to what other people are feeling. So many times I've seen individuals in the clinic, they're so dialed in to the emotions of other people that it's almost like they co-opt those emotions and then 10x them, right? So a baby's crying in an airport, and then you've got an individual who over-identifies with that situation and starts to get pretty frustrated because maybe the baby's not stopped crying, or maybe there's an unidentified need. Somebody shuts their finger at a door, and then the whole tenor of the room goes up because you have an autistic individual who's over-identifying with that, wants clarity, feels the stress and strain. But please, please, please make no mistake. Make no mistake. Individuals with autism feel emotions. They feel a broad and beautiful spectrum of emotions. And sometimes those emotions are super high, sometimes they're super low, but they are there and not to be negated, ignored, or stepped past. Next, this is a myth. Okay, remember, these are myths. Don't get mad at me. All autistic people are geniuses. Now, in my mind, yes, it's not a myth. I think they're all geniuses. They're all fantastic in their own ways, right? Everybody's a genius in their own way. I mean, if you think about it, everybody has these amazing skill sets and these deep, deep wells that you find out when you just do a little digging and a little scratching, a little asking. But what we mean here is like in the movies, okay? So, let me give you some examples. So, the answer here, the quick answer, the easy answer is sometimes. Now, have I had the pleasure of seeing individuals, autistic individuals who are absolute savants at certain things? Absolutely. I mean, it's incredible. I've got individuals I've served that can listen to the sound of a toilet flushing. They can listen to it and tell you what kind of toilet that is by the way the water moves and the way the flush works and all this stuff. I've got individuals in the clinic who know the capitals and the flags and can identify all of those for every country in the world. I've got kids in this clinic that can tell you everything you ever would want to know about a velociraptor and Godzilla and and the Titanic. Whoa. I mean, I'll tell you what, I got some serious genius. But what you have to understand is if you are an individual who's been diagnosed with autism or who is autistic, or you have a child, I don't want you to look at your situation and say, well, when's the genius stuff coming? Listen, your child is a genius. You are a genius in your own way, but it's not like it is in the movies. It's not like Rain Man. It's not like we can take you to, to a casino and you can count cards, or, you can just look at it. It's not like Good Will Hunting. You just solve equations as a janitor. Like, it's not like that. Okay. It's very rare. It's very nuanced. Okay. It's a very niche skill set that individuals often have, but you have to also understand that one of the hallmark features of an autism spectrum disorder, as it relates to a clinician who has been working with individuals on the spectrum for my entire career, is that individuals with autism, their skill sets can best be understood like the landscape, like the skyscape of a city, right? There's really tall buildings, and then there's buildings that are kind of not as tall. So there's like, he knows everything about the Titanic and he can do complicated math. He struggles with open-ended questions like, what do you want for lunch? There's these discrepancies, these tensions that exist between skill sets. So is your child a genius? Are you a genius? Yes, of course you are. But do you have to be to the way you are in the movies? No, that's exceptionally rare. It's popular on YouTube, but it's not popular in the clinic. But yes, these kids have skills, but intelligence in individuals with autism can varies widely. So that's the third myth that we're debunking is, yes, individuals can be geniuses, but by and large, just because you have an autism diagnosis or you're an autistic individual does not mean that you are obligated to be a genius. So let's remove needless, senseless, worthless guilt and move on. Next on the list, autism is caused by mistakes you've made. Oh boy. I've done some shorts on this. I think I've done other videos on this. I got it. We got to stop right here. Okay. We got to lean into this. Look at this one. Okay. Now listen, this is the word should. Okay. And it's crossed out like in Ghostbusters, like no shoulds are available here. You know what I don't want for you, for your family, for your therapists, for your IEP support team, for your extended family, for your spouse, for your special education teacher, for your grandparents. You know what I don't want? A pile of should. I'm sick of it. I mean, there is nothing that's more worthless that you can do to yourself than pile a bunch of should on top of yourself. Don't should on yourself. It's a waste of time, energy, and resources. Oh my goodness. Here's an example. Here's a little word experiment for you. Start a sentence by I should, and then fill in the blank with whatever it is. And then ask yourself, how do I feel after I say that? Spoiler alert, you're going to feel terrible, right? Listen, autism, okay, is there some underlying, is there some underlying contributing factors that can result in an autism diagnosis? Yes. Okay. Autism is a perfect union of a multiple different avenues that result in the diagnosis. The first of which is genetic. So there's the double helix there on the left. There are numerous amounts of genetic diagnoses that have autism as a feature. Okay. So I am also a geneticist. Okay. So when I see an individual who's been diagnosed with an autism spectrum disorder, the conversation about a genetic evaluation comes up. It comes up because autism, in my mind, first and foremost, should be understood as genetic in its origin. Now, that doesn't mean that I can diagnose or find the genetic change that's resulted in autism. The genetic basis of autism is multifactorial. There's multiple genes involved, multiple different regions of the genome that have been implicated. And so it's very difficult to do one test and say, oh, we found the cause for the thing. But you have to understand that first and foremost, autism is genetic. And then you add toxins, infections, and complications. Now, here's what I want you to understand about that. Traumatic birth situations, infections in utero, kids who have traumatic injuries to their brain. These kids can be predisposed or put at a higher risk for an autism spectrum disorders, or toxins that they've been exposed to that we don't even know or understand. So listen, don't look at this slide and find new and creative ways to feel bad about yourself. Okay, listen to me very carefully. There's nothing you could have done to cause your child's autism spectrum disorder. There's nothing you could have done to prevent it in the vast majority of cases. Are there exceptions? Yes. I doubt those exceptions are you. Okay, so please, as we go through these myths, don't fall prey to one of the biggest and most despicable lies of all, and that is that you are somehow responsible. You yourself personally for your own diagnosis or the diagnosis of a loved one or a child. You are not responsible. You couldn't have caused this and you could not have prevented it. Okay, now let's move on. Autism, the next myth we're going to bust. Autism only affects children. Only affects children. And listen, as we go through this, let me bring this up. Put your comments in the chat. This is live for a reason. Okay. So I have a comment section. If you want to talk, you have a question, you want to throw a digital beer can at me, this is the place and time to do it. That's why we do this live, so that we can talk. So put it in. If you're watching on the upload, put it in the comments on YouTube, and we'll do our best to get back to you. Okay. So that's what we got for you for housekeeping stuff. Let's back to the thing. Autism only affects children. Only affects children. Well, listen, if you're watching this, it's likely you're an adult, okay? And that you're not a child, okay? If you are a child, I don't know what you're doing watching this. You should get back to work. But, it's not true. If we look at the statistics, okay? If we look at the statistics, 1 out of 36 individuals currently, 1 out of 36 has an autism spectrum disorder, okay? And that's as relates to children 0 to 18. But guess what happens after 18 years and 1 day? You become an adult, and that 1 out of 36 transfers to the adult population. So does autism affect adults? The answer is yes, times 1,000. Yes, times 1,000. But here's what you have to understand is if you're an adult with an autism spectrum disorder, if you've been diagnosed autistic, there are challenges that you face, but there are skills and benefits and strengths that you also carry. Let's look at them quickly. Challenges are going to be social and communication. Of course, I mean, it's in the nature, it's in the name, right? Autistic individuals are by definition going to typically struggle with social communication strategies. They might struggle to some extent with employment, but it depends on what kind of employment, all right? It depends on what we're asking individuals to do. I tell families all the time, listen to me. Autistic individuals are like Ferraris. Okay. They go very fast. They're very precise, but they need to be on a very specific road to reach maximum capabilities, maximum speed. They need the right kind of gas, they need the right kind of road. So, but please don't make any mistakes. You get them in the right environment, and they will not only receive tremendous value from being in the community and providing good work, but they will deliver tremendous value. Okay. So, but employment can be a challenge, right? Sensory difficulties. So if you got a job and there's oppressive overhead lighting, or there's, bad music or whatever, there's sensory difficulties that can make their lives difficult. There's also, mental health difficulties, and individuals with an autism spectrum disorder typically have comorbid conditions like anxiety, transition difficulties, obsessive compulsive difficulties, perseverations. These things can make working a daytime job and working it regularly difficult, but not impossible. And lastly, sometimes they have difficulties with daily living and independence, which is one of our primary goals from the time an individual is diagnosed in our clinic. If you're hearing me, your primary goal is adaptive skills. Communication is going to be the top of the pyramid. We got to communicate. Okay. We got to communicate with sign language or word approximations or words or a device or whatever it is. We need to communicate so that we can help people understand what you need, what you want, and how amazing you are as best you're able, like if you're lost or you're in trouble, right? But the next thing on the list in terms of the hierarchy of what we most want to see developed in the lives of a child with an autism spectrum disorder in an adult who's an autistic adult, we want adaptive skills, independent living skills. Okay, let's make this big. I want you to learn how to live independently. I want you to put on your own clothes. I want you to wipe your own bottom. I want you to brush your teeth. I want you to learn the bus schedule. I want you to do these things. It's so important that we make adaptive skill sets, doing things as best you can on your own. The best question you can ask yourself as a parent, what's the next best skill? What's the next best skill this child can develop? I'm not saying you skip to calculus, okay? I'm not saying you skip to they're curling their hair with a curling iron. I'm saying, can they wash their hair? Can they brush their teeth? Can they take care of themselves in the bathroom? Of course, there's some challenges to adults in the workforce, but you know what else there is? Some strengths. Let's look at these. You know what? Individuals who've been diagnosed, who are autistic, okay, and adults that I know and love and serve in this clinic, you know what they are? Honest. One time I'm in the clinic room and I ask a kid, this is a young adult, and I'm asking him all these questions about what's this face, or what do you think about this face? Just trying to get a sense for where we're at in terms of interpreting facial gestures. And I do one of these, go, what's this face mean? And he goes, I think that face means ugly. Honest. You want a good friend? You want somebody to tell you that you're not good at something, or that your nose is crooked, or that your breath stinks? You need to be set on the right path and set straight, like my great grandma used to say. Yep. You need somebody honest, loyal, and straightforward. There's no question where you stand. There's no question. I'll come into a room and sometimes I'll do this to some of my favorite patients. I'll be like, yes, I've been waiting for 45 minutes to see you. I've been doing this in my office, doing this because I'm so excited to see you. And the guy will look at me and say, I think that your enthusiasm is a little bit too much. I find it problematic. He'll say things like that. And I'm like, oh, okay. Well, I get it. And I'm going to dial it back because you're my friend and I think you're amazing. Other things, focus, attention, and knowledge. Oh my goodness. Just because if you're an adult with an autism spectrum disorder, use these things as superpowers. Focus, attention, knowledge. Do you know everything about everything? No, neither do I. Or do you have to be the funniest person at the cocktail party? Do you have to have a little funny anecdote while you're at the water cooler? No, but you know what we do need? You know what we do need in this world? People who can give us focus, attention, and knowledge about certain aspects of the job that we need you to do and do well. And please know there are an abundance of jobs and vocations that demand a high level of specific knowledge in certain areas. That's what I mean about putting a kid on a road like a Ferrari and giving them the right road and hammer it. And then you're doing 250 miles an hour. And it's amazing. Okay. So, and then lastly, one thing I want to throw out again is the individuals can thrive in structure and routine. So just because you're diagnosed with autism, just because you identify as autistic based on, your evaluations, please know that you can thrive, but you have to be careful about what skills you choose to do. I don't know that being a rodeo clown is a great idea, right? Now, not that you can't do it, but it's difficult to find a structure and a routine in that. But there are other skills and vocations that do necessitate a structure and a routine to things that will lead you to a high place of success. Next on our list, all autistic people look and act the same. No. Okay, of course you know this. That's as silly that I have to put this on, but these are myths, right? I mean, we could talk about the jackalope too. It's the beautiful merging of a jackrabbit and an antelope. We could talk about that too. It's ridiculous, right? But people believe it's true. Okay. Some people actually believe that just because you have an autism diagnosis, just because you are autistic, that you look and act the same way as everybody else that they think. Now, there are a multitude of problems with this idea. Okay, of course, you've seen one individual with autism. You've seen one individual. You've seen one autistic person. You've seen one autistic person. You're all different. Now, are some of your base level struggles similar? Yes, to an extent. They have to be. Otherwise, we're not talking about being autistic. We're not talking about an autism spectrum disorder. It's these descriptions are predicated, these identities are predicated on diagnostic criteria that help demonstrate strengths and weaknesses. Okay. Or you could just say alternative strengths, or you could say an alternative operating system. I'm not trying to be offensive. Okay. But please know that individuals with an autism spectrum disorder, it's best for me, it's easiest to understand individuals who have an alternate operating system. Right. So it's not necessarily broken, bad, or wrong. It's just different. Right. So it uploads information a little bit differently. So we have to do work. We have to work together to figure out how to make this operating system effective in this work environment, in the school environment, in the family environment, or in culture. We're not trying to change the operating system. Okay. We're not trying to change it. We're just trying to make it run certain programs as best we can. So we're working essentially on compatibility. Okay. So, but individuals are different. Right? Some individuals are remarkably verbose. They come in, they tell me all kinds of things, but it's a little one-sided. I'm hearing a lot about the Titanic right now. You're not asking me a whole lot. I'm hearing an awful lot about renal physiology, which can be fascinating, but I really need to ask you a few questions about how school's going, right? As the other individuals that, if I have like a scratch on my face from one of my stupid cats, no offense to cat lovers, but I got a scratch on my face or something, and they'll see that and they'll just start weeping. They'll become viscerally, activated by that. They over-identify, right? So they're there with me, but it's, it's a very deep and heartfelt connection. I've got one kid that I've seen that whenever a Katy Perry song comes on the radio, he just sobs uncontrollably sobs, right? There are individuals that what I said to that kid is, look, I get it. I sob as well. I also sob. No. And now you can take that for what it is. Maybe I love it. Maybe I don't. But I'll tell you, it gets a visceral reaction out of this kid, gets a visceral reaction out of me. Okay. But maybe that's a good thing. Individuals with autism are different. Come on, you know this. Let's do another one. The best treatment for autism. Oh man, this is a good one. Okay. The best treatment is unproven and expensive. Oh boy. If you're going to throw a beer can at the screen, now's the time to do it. I'm not trying to be mean. I'm trying to tell you the truth in love because I care about you. There is a tremendous myth that is circulating like wildfire. Okay. That it is uncontrollable, unmitigated disaster. And that's essentially this. The only interventions that are good, that matter, that should be trusted are interventions that are unproven and super expensive. Let's look at a few. You know what? Let's look at a few. Can we just look at a few of these? Let's just unveil a few of the things that I've seen in my clinic. Well, Dr. Noble, we agree that speech therapy might be useful. We agree that maybe some occupational supports or some ABA. I'll do a video on that later. Don't throw a beer can when I said ABA. Okay. We're not trying to change operating systems. We're working on compatibility to run programs to be successful. All right. So, but we know those are good, but you know what's really good? We're going to go to Kansas City and do chelation therapy. And then I say, chelation therapy. They're like, yeah. So essentially what it is, somebody hooks my child up to an IV, which spoiler alert, not going to go well. We can't even get blood. I can't get regular blood work done on a lot of the individuals that we serve because it's a disaster. It's like going to the rodeo and drawing blood on a bucking bronco. Okay. Not great. And you mean to tell me that you're going to take that same risk, but you're going to put a needle in your kid's arm and do chelation therapy, which is essentially like binding of toxins in the blood and then flushing them out somehow. Now, there's a few problems with this. First and foremost, unproven. I'm going to say it again, unproven. Okay. Now, could you find, I thought about putting information on evidence-based best practice in here, but I think it's beyond the scope of what we're doing. Could you find somebody who wrote something down on a piece of paper about chelation? Sure. But listen, there's a difference in periodicals. Okay. When I was a kid, we'd go to the grocery store. My dad was a smart guy. He was just a super smart dude. Right. And he would read encyclopedias and stuff, but you know what else he would do? He would read the National Enquirer because he loved stories about Bat Boy. When I was a kid, Bat Boy was on the front of every National Enquirer because Bat Boy, but you know what? An encyclopedia and the National Enquirer are both words written on pages, but one I think is a little bit more trustworthy than the other. Just because you find somebody who says chelation therapy is good, or they wrote an article one time in a journal with an impact factor of 0.0000001, right? And no offense, but in a journal that's maybe, published outside of traditional Western medicine journals, I don't know that I'd put my stake in putting a needle in the arm. I'd save the $250 per session. And listen, do you think these are one-time sessions? You think it's like, well, there you go. We'll just do a session one time and then should get all the toxins out of the thing. Nope. They're going to have you come back a bunch of times. Okay. I'm not trying to be mean. And these people are trying to help you, but I'm also trying to help you. We're just trying to help in different ways. That does not work. Okay. And $250 a pop, you do 10, 20 sessions of those. Well, now you're in deep. Hyperbaric oxygen. Here's what we're going to do. Let's take a child with sensory difficulties. Let's take an adult. Sensory difficulties, transition struggles, difficulties with perspective taking. Let's lock them in an iron lung. Okay. Or some other kind of, in my mind, that's what it is. And let's do some kind of hyperbaric oxygen treatment that you do for people with severe burns. Okay. And let's do that a bunch of times. Let's do that for a week or two and see what happens for the low price of $8,000. Do you know how many bus tickets I can buy for some of the wonderful single parents that we serve in our community who live in one-bedroom apartments and have to ride the bus to wherever they live to our clinic and back again? That's a lot of bus passes. That's a lot of meals on Thanksgiving that we could provide people. But nope, we're doing hyperbaric oxygen because we got money to burn. How about this one? Gluten casein-free diets. Okay, now listen. Hold on a minute. I'm not saying that doing gluten casein-free is terrible. I'm not saying that. But there's a few things that you do have to understand. Individuals, autistic individuals, children with autism, tend to have what in regards to their diet? Okay, now you're thinking, well, they got gut issues and they got leaky gut. Okay, fine. We'll talk about that later. But you know what they do have? Oftentimes significantly difficult sensory obstacles as it relates to food diversification. They only eat 8 things. So then you're gonna remove those 8 things and you're gonna replace them with things that cost 3 times as much and taste half as good. I'm not trying to be mean right now. If you got gluten casein free stuff and you found success in doing it, I love it. You live your life. But I don't want you to think that there is a robust amount of data that unequivocally supports tripling your food bill. And that's, I'm generalizing. Okay. I know you're like, well, triple, I can go to the thing. I get it. Okay. I'm not here to split hairs. What I'm here to help you understand is that oftentimes this only makes families' lives harder and more expensive. Your child eats 8 things, and now you're going to replace these 8 things with 4 things, 3 of which taste kind of like cardboard. And it's for the low price of triple what it would normally cost. I'm not trying to be rude. Sometimes I eat gluten casein free stuff and I'm like, okay, this isn't bad. But I'll tell you, usually I'm not in love with it. Okay. People got to take that path for a lot of reasons because they got a legitimate sensitivity, and I respect that. Not trying to throw shade on it. But what I'm saying is if your child doesn't have a legitimate gluten casein free sensitivity, maybe save yourself the time, energy, resources, and pain. How about this one? Stem cell therapy. I know you're thinking, no, who does? Okay. You're maybe not thinking that. Maybe you're like, I do that. It's amazing. I've seen it, right? Kid, we got all these evidence-based best practice interventions that you may love, that you may not, that you get mad at me. Well, Noble, what are you're smoking a Marlboro Light in my mind. Well, what are you going to do, Noble? You're just going to do some medicines that don't work and blah, blah, blah. Okay. I get it. Fair point. Are medicines, are the interventions that I bring more effective than the things on this slide? Yes, times 1,000. Okay. But do they fix all the problems? Do they have their own set of issues? Is there big pharma concerns? Yes, of course. All those things are true. Okay. I'm not trying to say that I bring the very, very best of all the things. What I'm trying to say is I can prove to you that what I do should work, because it's not isolated. It didn't work for 4 kids in Norway at one time. It didn't work in one small group of people who all took like a certain amount of vitamins and like mixed it with some local herbs and honey, right, in a burlap sack and then ate it. I'm not saying that those things tend to only work in microcosms. I'm talking about things that are generalizable. I can prove that it works in certain populations with certain demographics on a broad scale. It's replicable, okay? But it doesn't mean it's always better. But listen, stem cells, not one of those things. Stem cells, not one of those things. Okay. Stem cells tend to be something that not a lot of people do. But as you can see, I mean, look at the price tag here. Peruvian stem cells. That's what people usually tell me. I'm going to go to Peru and get me some Peruvian stem cells. And I'm like, well, maybe bring back an empanada. I don't know if that's Peruvian, no offense to Peruvians, but bring back some coffee, make it worth your while, because they're going to burn $50,000. You might as well bring back some coffee or something useful. Okay. So Peruvian stem cells in general, there's not a shred of data to prove at this point in time that this is the direction you should head. And the cost is extravagant. And then lastly, homeopathy and supplements. Now listen, I love anything that's not a medicine. I love it, right? I don't want to put kids on medicines. I don't want to draw labs. I don't want to do all the stuff. Just because I wear a white coat and have some board certifications doesn't mean that I just, again, want to suck on my Marlboro Light. I'm like, well, let's just throw some pills in their mouth and see what happens then, and then go golfing. That's not what I want to do. Okay. It's not what I want to do. But I mean, I think it's also an important point to understand that, homeopathy and supplements are, I think, they're not always terrible, but they can be expensive. And this is a general term over here, $500 per month, but they can also have some side effects. I mean, too much B6 and too much B12 can cause some problems neurologically. So you really have to watch it. Okay. These things are not always innocent. Just because you go to somebody who did some Eastern awesome stuff and did a homeopathy thing and, has like some aromatherapy in their office with like somebody like one of those sounds of a bowl, just because they're doing that and they have like like some beads that hang over a doorway, it doesn't mean that they know what they're talking about. Okay. So they may be really nice, but just know that there's not a lot of data to support these things in the long term. There is some data. I'm not saying there's zero in regards to homeopathy and supplements. What I'm saying is there's not enough in my perspective to recommend this routinely or to justify a $500 per month expense or whatever it is that you are spending. Can you try it? Sure. But should it be a short-lived experience? Yeah, make it short-lived, because wow. All right. Let me give you a few strategies on how to think about making decisions as we get to the real value of what we're trying to talk about today. Okay. Here's the question I want you to ask yourself. If you're looking at interventions and you're not sure if you should do it, I want to ask yourself, is it sexy? Okay. Is it sexy? Is it sexy? Let me show you what I mean. Is it safe? Is it safe? Is it safe? Is it easy? Is it cheap? Right? Is it sensible? Is it sensible? Right? Like, does it make sense to you? Does it make sense? I want you to ask yourself these things: safe, easy, cheap, and sensible. Now, not everything I offer are those things, right? I get not all medical interventions are cheap and are accessible, but in general, if you want to try something that's a bit nuanced, go through these questions and ask them of yourself. Because if it's none of those things, the likelihood is going to be this amazing breakthrough for you is really, really low. If it's behind extravagant paywalls, well, okay, and numerous visits, I've got some questions. It's time to show me some data. So please show me the data. Now, lastly, the last thing I want to talk about, people with autism will never fill in. Let's fill in the blank. Let's fill in the blank. I don't care what you fill in the blank with. This statement is patently false. Individuals with autism will never get married, never be happy, never live independently, never get a job, never have a friendship. Lies, all lies. You cannot start a sentence about autism, about an autistic individual with, you will never, and then fill in the blank with whatever you want, because I promise you it's going to be a lie. How do I know? Well, aside from 20 years of doing this, if I had $1 for every time a family came to my clinic with a known genetic condition or a tumultuous prenatal history or an NICU stay, and they said to me, they told us that our child would never fill in the blank, walk, talk, laugh, smile, turn, raise, contribute. I don't know why there's certain factions of physicians and care providers who love telling people what they think is the honest truth, when it is nothing more than shaking a magic 8-ball in the doctor's lounge and be like, will this child walk? Unlikely. Like it doesn't work. Okay. So don't allow a diagnosis to limit your prognosis, your future for yourself, for your child, for your loved ones. You are not limited by a diagnosis. You are only limited by, really your desire to build effective communication strategies, your desire to build adaptive skills, your desire to build in yourself or your children the resilience necessary to stand up, dust yourself off, and keep going. We're to the end of our time, and I want to give you information that you're going to value. Okay. If you want information about stuff that you're not easily going to find, okay, we have several courses coming out this year. How to parent like a pro wrestler. Tell me you don't want to take that course. You tell me right now you don't want to take that course. It's going to be probably 3 weeks long. I'm going to go through all the things that culture's doing that I hate and the things that you need to do to be successful. And lo and behold, the best solutions are in pro wrestling. Okay. Not because we're advocating violence, but it's the pageantry and majesty of it all. And it works. How about Autism 101? You want to get deep? You want to roll up your sleeves and understand what the 5 core features of autism in regards to therapeutic interventions, what's the evidence behind it, what you need to expect, how you need to line it up, and why it's so important. That's me doing that for you. Autism, the natural interventions. Let's get into it. Let's get nasty. Let's go through each one of these. Let's decide what's a keeper and let's decide what's thrown away. If it's out there and it works and it's not a medicine, I want to know about it and I want to talk about it with you. Fostering autism. If you're thinking about fostering a child with an autism spectrum disorder, there are an numerous amount of children with neurodevelopmental disorders like autism, as an example, in the foster care system who need to be cared for by people like you, but maybe you're afraid. You don't know what to do. You don't know what to expect. You don't know what to think. I'm going to teach you. I'm going to teach you how to do this so that we can get these kids out of a transient situation and into your forever home. We're going to talk about ADHD interventions that are natural and medications, the parent survival guide. Wouldn't it be nice to know when you're dealing with medication problems in kids or behavioral problems in kids, what kind of medication strategies are typically available and which ones you should maybe consider? Andrew Springer, the world's greatest, one of the world's greatest, because he's got a brother who's also a realtor. Pro Wrestle Parenting, he's in. So you want to join Andrew Springer on the world's greatest stage of parenting, then get in here and get after it. Okay. That is one-on-one. And then the last thing, if you want to stay up to date on all this stuff, we're slinging. All right. Join our very good newsletter. That's written awkwardly on purpose. Okay. Join our very good newsletter where I'm going to send you stuff that's primarily going to encourage you every month, maybe every week, so that we can do this together. Listen, thank you for your time, energy, and resources. And to conclude with this, you have a difficult situation if you're watching this video. Either you yourself are up against it or you're raising a child up against it. What you have to understand is that there is no one better on the planet to do this great work than you. Okay. I refuse to believe that we are given situations that we are not also given the strength to navigate through them. The situation that you're in is for you and you're the perfect person to do it, but we need to do it together. Thank you all for your time. I have loved it. Let me know if you have questions. Yes, you. 9 a.m.